Welcome back. Now I understand why when you go to hospital and you have a respiratory, maybe a cough, the doctor tells you, breathe in, out. You know, this is some of the things that we never get to understand when the doctors are doing it. But again, you have explained it so well. And I'm wondering, when it reaches a point where there's difficulty in breathing, for whatever circumstance, what exactly has gone on in the human body?
Yeah, so actually that is when you find it is actually less than 75%.
Okay.
When you are not sure but not sure, but when it's clear less than 70, then you are sure there is clearly what you call obstruction. That's the word, obstruction. So when you talk about COPD, chronic obstructive pulmonary disease, that is one of the things. You actually force yourself to breathe, both in and out. The air is never enough. You actually feel it is shallow breath. So it is never enough. So obstruction, the blockages, the reduction of the lumen of the passages, so that there is not enough force. The air does not go deep enough to be able to reach the alveoli, where there is supposed to be gaseous exchange, where there is supposed to be oxygen being taken in by the hemoglobin, and also carbon dioxide being taken out and picked up by this same hemoglobin, so that it comes out as carboxyhemoglobin. That exchange at the alveoli is weakened and reduced, and therefore you find somebody, because they are not having enough oxygen, enough exchange, therefore almost all the other organs slowly just start sort of having problems. That is at one level. At another level, because that is respiratory, there is a connection with cardiovascular, that is the heart and the related blood circulation system. Now, so when some cancer starts developing, because you know, this material is actually deposited along the walls of the, but it's also very fine. Some of it finds its way into the blood. It is very fine, so it may find its way to the blood. The little that gets its way into the blood, more or less, again, starts causing challenges in the blood kind of quality. So that basically, therefore, the blood is not pure, and therefore its ability to perform its role may be reduced. That's one. Another important level is that government is there because some of them are actually cancer causing, what you call carcinogenic. They may start causing cancer both within the respiratory system and in the system, the blood system, where they are actually deposited. But you see, the body is always looking for this foreign material to look for how to cope with them. When it is too much, they look for a way of fighting. When it is too much, their fighting capacity is actually overwhelmed. So it is this overwhelming level that becomes a challenge. So the body, instead of now, because it will try to throw some out using its own systems, but then there will be the other way now of trying to look for how to keep some in a way that they are not directly interfering with the body. Often, a lot of this is actually taken and stored around major organs, around the lungs, around the liver, around the kidneys, around particularly the fat tissues around those systems. That's why you have a lot of these excess kind of pollutants. They get deposited in those areas in a way that the body is trying to, if it's overwhelmed, its own normal systems is not able to throw everything out. Then it can store them, but at least in a passive form. But a challenge comes when, for whatever reason, one loses appetite. Then this fat normally is the one that is actually mobilized, so that it actually goes now to start providing the energy. The fat, what you call the lipolysis process. The fat particles being broken down so that it can now go to provide energy, because the carbohydrate is no longer enough, because somebody has no appetite. At that point, you will find that most of these kind of poison that were around the body organs, they are mobilized. And very quickly they find themselves into the blood. And then as they spread in the rest of the body, somebody, even if the doctor thought that the patient was recovering, all of a sudden, you die. Those are the cases of what you call unexplained and sort of sudden deaths. Those are some of them. Somebody accumulated so much poison, but for whatever reason, appetite was lost, or somebody, for whatever reason, was not able to have food. Maybe are in a desert, in a place where whatever. There are those circumstances. So you have no access. So the body looks for how to go to the granary. After you finish the maize in the house, you go to the granary. But the granary is that what you call the tissue, in fact, around the skin, the adipose layer, the fat tissue, just under the skin. This is another store of that kind of waste, of the poisons. So this is mobilized, and other fats around the major body organs are also mobilized. They go to the blood, and then you find yourself all of a sudden, there are organ failure, there is almost sudden death. That is a direct impact. Another impact, I did mention that.
And maybe just mentioning, currently or in the recent times, we have a lot of, kidney failure diseases, heart attacks, even among very young people. We have, the issue of you go to the doctor and it's like, the cancer has spread. You see, I'm trying to link all these happenings to whatever you're explaining, and I think it's very important that we pay attention to exactly what you're explaining to us today.
Yeah, that's right. So that's under organ failure. So these days, dialysis are very, very common.
Exactly, yes.
Yeah, my auntie died 2012 because of dialysis. A senior lawyer, who was actually the first lawyer ever to get a first-class honors in Kenya here, the late Jared Tirikowadi, died from heart failure. Some almost 10 or so years ago. Heart challenge, kidney failure.
Kidney failure,
These conditions have become part and parcel of us because we are trying to modernize but live in a polluted environment. So that is an aspect of organ failure. That is a direct and sometimes indirect impact of pollution. Another aspect I was talking about, cancer. Cancer goes through different stages. There is initiation, there's progression, and then there is what you call the spread. The spread where the condition now is like malignant. Now the cell no longer cannot hold itself in one point. The cancer is just the swelling, uncontrolled swelling, growth and multiplication of cells. That's just our cells, normal cells. But the cells normally, each part of the body, the cells, specialized cells, are supposed to have specific size and rate of multiplication. So when that capacity is lost, then they can grow at whatever rate, and they can multiply at uncontrolled.
The common thing that we use here in Nairobi, the common perfumes.
That's right,
Do you have a comment about it? Because I would like our viewer to just get something out of this so that we are able to move forward in a healthy manner.
Perfumes, one thing I would actually teaching my students foundations of environmental health. I taught that in KU for 7 years. One of the things I would actually tell them, particularly girls, because I know boys are used to sabuni ya miti, but for girls use lots of complicated things. Of course, a number of boys have also taken that route. I would tell our girls, please, it is better to be averagely beautiful and maintain that the rest of their life than trying to be too beautiful by applying a lot of things on your body, then becoming too ugly the rest of your life. Too ugly in the sense that I did mention what is dislodged, what is kept under the skin. Most of these things, actually, even the perfumes and other things we use, most of them have actually been sort of thrown. They have lost what you call, they are not within standards. Elsewhere, they have been actually rejected elsewhere. So they are actually imported into most of Africa. When they are imported, we use them without even caring. When we use them, some of them actually contain, particularly the skin lighteners. Skin lighteners are the most dangerous because they basically will be having some aspects of some components of heavy metals. So they'll actually very clear the surface of the skin. The mature cells, which actually would be like heavily pigmented, would actually be peeled off. And therefore, you quickly have the direct sun on immature cells. So the ultraviolet radiation we talked about that through the ozone layer depletion, quickly you find that light-skinned people therefore will quickly have these kind of conditions. Skin cancer is more likely under those circumstances than for a darker skin, but we use these chemicals to sort of lighten our skins. Two, some of them as they stay, some will penetrate, and then of course because they are with the chemicals, again some will be kept under the skin, the poison under the skin. But then of course they'll not be innocent poisons. They'll be staying there 5 years, you think you are normal, Then after some 10 years, you find some small swellings you can't control. You start going to the dermatologist. After some time, you find even the dermatologist has given up. It's not controlled. Then you find huge kind of swellings. I used to tell the girls, please keep yourself averagely beautiful than trying to fake artificial beauty, which of course throws you to the dustbin too fast.
Yes.
That is in terms of what you just asked. But talking about the air pollutants, the ones that have gone through the body, you have seen where they have been kept around the body organs, and also some along the blood vessels, and also along the respiratory system. They are actually kept there at various levels. Now, so reducing the size of those systems, and therefore for blood, because the more they are, the body is looking for how to the next to keep any extra baggage. So maybe even some of it under the blood. So when you have maybe a bit of the fat plus now that blood, of course that chemical gets deposited under in the inner surface of the blood vessel. Again, that reduces the size of the blood vessel. The thinner a pipe is, even if you talk about a hose pipe, the higher the pressure, automatically reduced pressure, or rather reduced lumen, reduced passage. The same amount of, the person size has not changed. The size is the same. So the demand on water, oxygen, on blood supply is the same. So it will be forced to pump faster than normal, because now the passage, you are with a tractor, but you see part of the road is blocked. So what do? When you reach that point, you run faster so that you are able to cut that blockage. That's exactly what happens. So when the blood is flowing, because of the reduced lumen, then you are going to be finding that more and more of this pressure actually causes a possibility of the heart to fail. Heart failure.
Now it's high blood pressure.
High blood pressure. Automatically it's high blood pressure. But of course, it has got its own other consequences. It has got that direct, the heart can fail. But again, it's also overworking the kidney, because the kidney also does the filtration depending on what it receives. The kidney does filtration, that's the filter of the body. So the higher the pressure it is made to work under, how the chances of organ failure. Again, you see an aspect of it arising from just hypertension. So that's an aspect that is important to note. Another aspect related to the cancer, because cancer, we talk about as uncontrolled sort of growth and multiplication of the cells in specific parts of the body. Now, because these things are actually kept around the major organs, in the walls of the passages, and also around the whatever covers the organs, the swellings again will result in less and less of the blood to flow, because they'll be pressing on some blood vessels. As they press the blood vessels, again you'll find that pressure again increases, because it's a normal kind of passage, then some swelling is there along the path or somewhere in the neighborhood. Automatically it presses that space, so it's reduced, pressure increases. That's another angle through which hypertension comes in, and also therefore possibility of organ failure.
We are going for a short break. Stay tuned on the platform.